Okay, you've just been told they've got a diagnosis for you. It's good news. They found out you have a condition called vasculitis, and the consultant is keen to see you treated with this thing called Rituximab. It's all going to happen pretty quickly now. They're going to book you into hospital for the infusion, and here's a prescription to get started on before the infusion starts. You've left the consultant room. It's all in a spin. Things have suddenly happened so quickly now, and you can't remember really what was said. Hopefully this will help to guide you into it, because you're not the only one. The same thing happened when I went through it as well. So you've been told you've got some type of vasculitis. They've maybe said it's an ANCA vasculitis, ANCA-associated vasculitis. Maybe they've been more specific. They've maybe said you have GPA. What does that mean? Granulomatosis with polyangiitis. Maybe you've got one of the other two, MPA, microscopic polyangiitis, or EGPA, eosinophilic granulomatosis with polyangiitis. It's bad enough trying to get your head around the names of these conditions. But then there's the treatments. You're going to receive a Rituximab, and there's also going to be a steroid. Well, that's how it starts. So, you get your prescription. You've got the steroid to take. This will knock back your immune system, because it's your immune system that's attacking yourself. Vasculitis in the name. Vascu is vascular, and it's an itis, it's inflammation. Your blood vessels get inflamed because your immune system attacks them, causing the inflammation, reducing the blood flow, and causing problems. So the steroid is to knock back your immune system. It'll probably be prednisolone. You'll probably start around 60 milligrams per day. It will look something like 12 5-milligram pills that you've got to take in the morning each day. This will slowly taper down over the next 3 months though, so it won't always be that amount. There's also the Rituximab infusion, and that, in combination with the steroid, also knocks back your immune system. Now you might be thinking, my immune system, I need that, don't I? Yeah, yes you do, but it's attacking you at the moment, so this is one way to help you. It knocks back your immune system, which means, yeah, your immune system's not as good as it was. You've got to be careful. Certainly over the next few months, maybe the next couple of years, until things get back. Just got to keep that in mind. But it's to help you out, because your immune system is trying to do really bad stuff to you. In addition to those two main things, the steroid and the Rituximab, you will probably also get things like Adcal D3, another box of pills that's to protect your bones against the steroid, because the steroid can contribute towards osteoporosis. There may also be an alendronic acid, which also is to protect your bones against the steroid. There could be omeprazole, that's to help your stomach cope with the steroids. And you may also receive cotrimoxazole, which is there to help prevent you picking up a nasty infection, which you're more susceptible to after receiving the Rituximab. So that's a bunch of medication that you're going to have to work your way through each morning. When it comes to the day of the infusion, which should come around really quickly, they'll get you in there, check that you've not got any infection coming on, you're generally feeling okay, and then things start. You'll get the cannula fitted to your arm, or somewhere appropriate for yourself. and they'll start you off with some medications. You'll get a couple of pills. One of them will be a paracetamol, which I believe is simply just to reduce your chance of a temperature building up as the infusion goes on. There's also an antihistamine pill to prevent an allergic reaction to the infusion. There will also be something that looks like 2 infusions, bottles of liquid hanging from the drip that are fed through the infusion machine. The first one will be a hydrocortisone, which is a steroid. And then the second one is the actual Rituximab. That will be started at a very low, slow rate, and they will regularly come through and check up on you. Make sure that you're coping with the infusion well. Some people have a reaction to it. And as long as you're coping with it well, they'll increase the rate. And then they'll go away and come back again and increase the rate. They'll go away, come back again, increase, and that goes on and on and on. Just to try and get the infusion into you as quickly and as safely as they can. And that's the infusion. Now, after that first infusion, there will be another one repeated in 2 weeks' time. Different hospitals do it in different ways, but from my area, this is the way that the procedure is done. A fortnight after the first infusion, there'll be a second infusion. Then that's likely to be repeated every 6 months for something like the next 2 to 3 years. And then you'll be reviewed and they'll decide whether it looks safe enough for you to stop, because hopefully you're in remission, or they want to continue on because they're either controlling your remission with the infusions or you're not in full remission yet. The steroid, it will be tapering down gradually over a period of something like 12 weeks until you get down to around 10 milligrams per day, and then it will be tapered even slower. So instead of the 5 milligram pills, and at 10 milligrams you'll have 2 of these 5 milligram pills each day. After that, they're likely to swap you on to 1 milligram pills, and they'll maybe step you down in 1 milligram steps. The reason for that is somewhere between 5 and 10 milligrams is what your body naturally creates of a steroid. So while your body's been flooded with steroids, your internal production of steroid has stopped. And to get that to kick back in, they will slowly bring you down past that critical level of about, it's maybe about 7 milligrams. And with any luck, your internal system for producing the steroid, it will kick in. If not, they'll have to try even slower, maybe go up and down with the dose to try and coax your natural steroid to kick back in. After that, all going well, that should you be en route to a reasonable recovery. That's all I've got to say for this part just now. Hopefully that information's been useful and it helps you out if you've been in a panic wondering what's going to happen next. It happens to us all. It all comes on so quickly, you don't know what to expect. And knowing a little bit of what's around the corner, what's coming up, maybe that will help the next few weeks to pass without too much stress. You've been under enough stress so far. So I hope that's helped. feel free to leave a comment below, and good luck with your treatment. Hope all goes well. Until the next video, thanks for viewing.